And then there was another thing about like how to recognize drug names. I think, Billy, this was your question, right? Let's hit this one quick. This is also in the comprehensive study guide. I keep mentioning comprehensive study guide. So if you haven't checked out the comprehensive study guide, make sure you check that out. Now, some drug categories that you definitely want to know are beta blockers. Beta blockers are used for things like blood pressure, heart rate, okay? And they typically end in law. Esmolol, sotalol, propranolol. Oh, wait a minute, propranolol. Wait a minute, I heard that. There's a situation that we use propranolol as the beta blocker of choice for. Type it in the chat. What's that situation called? Type it in the chat. Thyroid storm, yeah. Okay. So beta blockers are your laws. You want to know that. Another drug that's used for blood pressure is going to be your ACE inhibitors. These are known as your prils. Lisinopril, enalapril, enalaprilat. There are lots of prils, but the prils are your ACE inhibitors. We also have ARBs. These are angiotensin II receptor blockers. ARBs. They end in sartan, valsartan, losartan, candesartan. The sartans are your ARBs. Something else you want to know is both ACE inhibitors and ARBs cause a condition, or they can cause a condition called angioedema. Okay? You can have ACE inhibitor-induced angioedema. You can have ARB-induced angioedema. What's angioedema? It's where the tongue, the lips swell. Tongue and the lips swell. It can cause airway issues, airway compromise. So if this is your patient, they've been taking lisinopril for their blood pressure for 20 years. Today, their tongue is sticking out their mouth, is twice the size, and they're having trouble breathing. This is a life-threatening emergency because if that airway closes, you're not going to be able to tube them, and they're going to need a surgical airway. So you need to immediately be prepared for a quick and aggressive intubation. When I say aggressive, I don't mean be rough, but I mean you need to hurry up and get it done. Because if we don't get this tube, we're going to lose their airway and we're going to have to make an airway and we're going to slit their throat with a surgical airway. Okay? Now, this angioedema is different than the angioedema caused by, so angioedema can be like where the tongue swells, the lips swell. That can happen in an allergic reaction or anaphylaxis. The difference is what's causing the what's causing the angioedema. In anaphylaxis, the main problem is histamine. That's why we're going to use a drug like an antihistamine, diphenhydramine or Benadryl. But in ACE inhibitor-induced angioedema, the main problem is not histamine, it's bradykinin. Bradykinin. Okay? So your regular treatments that you would normally use for anaphylaxis don't work in this case because it's caused by a different problem. Okay? So there's a whole list of C1 esterase inhibitors that the hospital will give. You probably are not going to have those in EMS. Just know for this situation, they need a different set of drugs than for this situation. Both of them can cause the tongue and the lips to swell, but it just kind of, that's why you got to get a good history to figure out, is this an allergic reaction? Like, did they get stung by something? Did they have a bee or wasp or something, or shellfish, eggs, peanuts, chocolate, strawberries, some kind of allergy, medication allergy, things like that? Or did this just come out of the blue? If it just came out of the blue, you want to ask questions like, hey, do you take blood pressure pills? Do you take lisinopril, enalapril, any of the prils? Let me see your meds real quick, okay? And just know both of these situations are life-threatening, but we've got to be prepared for immediate intubation. Some other drug categories to know are like your calcium channel blockers. They're also used for blood pressure. They're used for a lot of other situations. Prince metal angina, things like that. These are like your penes. So like your dipines, amlodipine, nifedipine, nicardipine. Those are your, what kind of calcium channel blockers, Billy?
Calcium channel blockers.
Which kind? Because calcium channel blockers come in two flavors. What are they?
Oh, the
We have what are called dihydropyridines
dihydropyridines and yeah.
and non-dihydropyridines. Okay? Dihydro and non-dihydro. Okay? But the dipines, like nifedipine, nicardipine, amlodipine, those are the dihydropyridines that dilate blood vessels. And your non-dihydropyridines, they work on the heart muscle itself. Okay? You want to know things like your statins. These are cholesterol-lowering medications for the condition hyperlipidemia. So when your cholesterol is high, doctors like to put you on statins. However, so if any of you are on statins, they're not necessarily always safe because they can cause all kinds of things, all kinds of problems. They can totally destroy your muscles, lead to things like rhabdo, tumor lysis syndrome. So don't be so quick to just, like if your doctor wants to put you on a statin, which that's kind of it's just common, but sometimes doctors don't think. Or sometimes doctors don't know. They're just doing what everybody else is doing. Like there are a lot of paramedics who they don't really know. They're just doing what everybody else is doing. We really want to understand the medicine. And what I'm saying is statins aren't always good. They can cause a lot of other problems. Because sometimes it's not that you need cholesterol. It's like this lowers the cholesterol, but sometimes we got to figure out, well, why did it go up? It may not address the actual problem that caused your cholesterol to go up. That's what really needs to be addressed. Okay. Some other things to know would be like loop diuretics. These end in semide, like furosemide, budesonide, the semides, those are loop diuretics. Your PAMs and LAMs, those are benzos used for seizures, anxiety, things like that. So your benzos typically end in PAM or LAM. Oxalopam, midazolam, things like that. Diazepam, lorazepam. And then some common antibiotics, we could go, there are about 1,000 antibiotics. But something you may see is drugs that end in mycin. So azithromycin, clarithromycin, vancomycin. Any of the mycins, they're going to be antibiotics. So this is a good list of commonly prescribed drugs that I would know. And these are easy, and they also get tested because they have common suffixes. Like we also, let's add something to the list. The ones that end in "phil," what are they? What's that class? These are going to be our PDE5 inhibitors that treat the condition erectile dysfunction. Okay, so how did you guys feel about tonight? And by the way, it wasn't that I was just randomly talking about topics. These were actual topics that got submitted on the form. And so I was answering questions that got submitted in the group. So what did you learn tonight? Let's go, Brendan. Brendan, just come off. Everybody come off mute and just let's get through this quickly.